So, just a brief introduction about myself. Like Carissa has said, I am a Nigerian-born mental health advocate. I'm a public speaker, founder of Salt City Advocates Society, a nonprofit organization that caters to the well-being of immigrants and new refugees in Canada. I have over 5 years experience in public speaking, and my dynamic presence has brought me to stages and platforms across communities where I lead intimate events. I host conversations rooted in lived experiences. I am deeply passionate about building a safe space and culturally grounded spaces where people, especially women of African descent, can connect, reflect, and reclaim their joy. So today's discussion, so our scope of discussion, we're going to do an introduction of reclaiming your mind with a digital detox, why this matters, the chronic digital age, what is a digital detox, digital dilemma, signs of a digital detox, digital overload, and powerful shifts, impacts on mental health. I just did my intro, that's me. So, welcome everyone, and thank you for joining me today for the Reclaim Your Mind with the Digital Detox. I'm Sosa Erica Valentine again, and I am honored to be presenting this session in partnership with Safecare BC. Thank you, Safecare BC, for having me, an organization that's deeply committed to the safety, mental health, and well-being of care providers across British Columbia. I know that as healthcare workers, you're constantly connected, not just to your patients, but to your screens. We're constantly charting, messaging, documenting, and navigating digital systems from shift start to end and often beyond. So this session is about understanding the impact of digital overload and giving you tools to take some of that space back. It's not about ditching tech, it's about detoxifying with intention. So I'm going to share my personal story. I'm a registered nurse and I work 12-hour shifts. Those are very long shifts. My days are filled with care, compassion, and lots of screen time because I do document a lot. I mean, that's the expectation for us healthcare workers. And once I've assessed my clients and ensured their needs are met, I find myself, glued to the computer screen, documenting every detail of my encounter with them. At first, I thought it was just part of the job, but over time, I began to notice the toll it was taking on my mind and on my body. There were days my eyes ached from staring at the screen. The bright lights, constant alerts, and back-to-back tasks left me feeling overstimulated and drained. And even when I had a quiet moment to myself, it wasn't just physical, it felt like my mind got a break, never got a break. This realization made me more intentional about creating stillness in my life. I started taking screen breaks when I could, stepping outside during my breaks, and grounding myself with simple rituals, breathing, stretching, closing my eyes, even if it was just for a minute. It also reminded me of how important it is to have conversations about digital wellness, especially for those of us in caring professions where we give so much of ourselves on a daily basis. We do that, but we also deserve space to rest, reset, and reclaim our peace. So why does this matter? As you can see, I have highlighted 4 points on my slides, but I'd like to tell you, I mean, we all know this. We are living in an age of chronic digital exposure. But it's more than that. We've moved into an era of digital dependency. And while technology has absolutely improved how we deliver care, document, and stay connected, it's also created a non-stop, high alert environment for healthcare professionals. In healthcare, this impact is intensified. A 2023 study showed that nearly 50% of healthcare workers report burnout, and nurses are carrying the heaviest loads, reporting burnout rates as high as 56%. Have you ever thought, what is driving this? And one of the strongest predictors is work overload. Much of it is digital. Another review in Digital Health 2023 pointed to the poor emergency health records usability and after hours documentation as top contributors to clinician stress and burnout. Let's pause on that. We're expected to be efficient as healthcare workers, responsive and always available, chat in real time, stay on top of digital communications, learn new platforms, and still show up with empathy, accuracy, and compassion. But this always on culture is draining, and it could be draining for our minds. And without boundaries, our nervous system stays in a state of alert, leaving us overstimulated, sleep deprived, and disconnected from our own well being. And here's the truth: burnout doesn't just affect you, it's a ripple effect. It affects your care teams, your patients, and even your personal life. It seeps into your energy, your sleep, your joy, and your health. But we may not be able to change the healthcare system overnight. But what we can do is reclaiming small pockets of presence, tiny intentional moments of peace, rest, and personal space. And that is the goal for us today, to explore ways we can interrupt the burnout cycle, even in small ways, for the sake of our minds, our bodies, and for the people we show up for every day. So, what is digital detox? Digital detox isn't about going off the grid or quitting technology altogether, especially in healthcare, where digital tools are essential. We can't and shouldn't disconnect completely. Instead, a digital detox means taking intentional breaks from the screens and platforms that drain our mental and emotional energy. It's about creating boundaries, rest, and reclaiming your cognitive space. Let me share some real life examples of what a digital detox might look like in practice. Turning off your phone to grayscale mode, avoiding screen use for the last 30 minutes before bed, choosing one day a week to not chat from home if you work from home, and taking mindful moments during your shift, and even 1 minute to stretch, to breathe deeply, or simply sit in silence without going on your phone, because sometimes that's what we do on our breaks. Without a screen, you can definitely reset your nervous system. But when we think about the healthcare digital dilemma, healthcare professionals, we face one of the heaviest digital burdens of any workforce. Nurses, care aides, allied health staff often spend up to 50% of their shifts on electronic documentation. And for many, the work doesn't end when the shift does. Some of you might have heard the term pajama time, which is definitely stealing recovery time. That is when you find yourself finishing charting at home late into the evening. As a matter of fact, a 2023 study published in Mayo Clinic proceedings revealed that 63% of physicians felt electronic health record systems made their jobs more inefficient, not less, adding to frustration and emotional exhaustion. But it's not just about time spent, it's about work fragmentation. You are constantly pulled between direct patient care, alerts, digital messages, and mandatory data entry. One task gets interrupted by another, creating ended multitasking that erodes your focus and mental clarity. During the COVID-19 pandemic, these pressures intensified dramatically. A 2023 PubMed review linked the digital overload directly to increased burnout, lower job satisfaction. Most of us went into healthcare because we do have a passion for it. But by the time you begin to have low job satisfaction, your chances of quitting your career are higher. And even the intent to leave the profession. This matters deeply because you didn't enter healthcare to manage inboxes and self-care software. We entered to be hands-on and to have direct patient communication and direct patient care. Yet, ironically, the digital systems designed to help often stand in the way of the connection, presence, and peace of mind that you want to offer and you deserve. So what can we do? How do we protect our well-being within a system that won't slow down? That is where small, intentional shifts, like practicing a digital detox, can make a real life difference. I would like us to do some pause and reflect questions. I'd like you to answer these questions. What are three digital distractions that frequently pull your attention away during the day? How do these distractions impact your energy, focus, especially during or after work? I want you to think about one small boundary you could set today to reduce digital overload. And also recall a time when you felt truly present and calm without digital interruptions. And what does a healthy balance between digital connection and digital detox look like for you personally? So I'd like to give you 5 minutes to pause and reflect, and we can probably 5 minutes to pause and reflect, and at the end of the session, we can talk about it.
All right, so Carl says that I'm assuming this is for the first question, for the digital distractions, that some things that pull him away are phone ringing or vibrating because it interrupts your flow of work or non-work time. If you have any other, if anybody else has answers to the questions, feel free to plop them in the chat. Someone said Apple Watch, and I also agree as someone who wears an Apple Watch, it can get very distracting. Uh, maybe instead of other distractions too, maybe what are some small boundaries as well? Another one said Instagram. Yep, for sure, Instagram. If you're working on a project, input comes in from others at all times of the day and night, especially if you work across time zones. That's a good one to point out. TikTok steals my time when I let it. Someone said not turning work phone off in the evening. Someone said for the boundaries question, I purposely leave my phone downstairs when going to bed so it doesn't wake me if vibrating for alerts. It's very smart. Someone said, feeling as if I don't keep answering, I'll miss something important. So worried if they don't have, their digital device on them at all times, they can't really unplug, they're going to miss something. Someone said they leave their phone at home when they're on a walk, or same thing, kind of stays in the kitchen overnight. Someone said I turned off all my notification and my ringer for my own mental health. Yeah, that and do not disturb settings are very beneficial for sure. Someone said I feel the most present and calm when I have no cell service. Another person said, I am just thinking now that making different rings on my phone for family, work, and others so I don't have to look at the screen to triage during my workday. I downloaded minimalist phone, so that means no flashy colors, timers, and screen usage. It also has a screen usage time counter. Yeah, that's very helpful. Yeah, this other person said their phone goes into do not disturb mode every day from 8 p.m. to 8 a.m. to help mitigate distractions. It also always is on silent, and important people have a certain specific ringtone. D&D when focusing on a task at work. They said they also struggle with FOMO, but always let my team know that I may not respond right away. Someone said the often constant avalanche of emails is my biggest challenge. This is a good point. Someone said, I often think doom scrolling is relaxation, but it is draining. Yeah, because most people turn to it to calm down, but I feel like it heightens our nervous system instead. Someone else said, I feel present and calm when I do my workouts as I take classes where phones are not allowed. Someone said what helped them was deleting all the social media and news apps. Someone said, I've gotten into the habit of changing the focus at the end of the day by doing a digital jigsaw puzzle. and suggests maybe she should go back to knitting. So reinforcing those hobbies.
I definitely
Yeah.
do like energizes your brain.
Putting the phone down, spending more time reading, revenge bedtime procrastination, and doom scroll YouTube shorts. Those for sure a hard habit to break. Someone said they do read books on their phone, but they have a setting that when they open their book app, their phone automatically goes into Do Not Disturb. I don't know if this might help the other person. Apparently, you can block your ability to watch reels and shorts on platforms. And someone else said, most present and calm when I sit on my porch, then there's no internet available. Love their swinging bench, and it's the best if they can get up early in the morning to enjoy it, to help them stay present and calm. Other great suggestions, including meditation, mindfully walking in the nature. Someone else said monitoring time spent on online communication. So I know sometimes our phones get those weekly recaps of how much digital screen time we've had. Someone else says they used to play games before they go to bed, but now they just listen to calm music.
You have a very interactive group. Okay, so thank you all for sharing ways you could actually like keep your minds from, being digitally overstimulated. I'm just gonna continue on the session. So, what are the signs that you might need a digital detox? Number one, you constantly feel irritable and anxious. And if you can't check your phone, you even get overly anxious. You scroll endlessly after shifts, but you don't feel relaxed. I'm guilty of that. You check your work messages during personal time. Your sleep is disrupted when you are tired. One thing I have been doing, when I go to work, I don't take my phone into work. Actually, my work doesn't allow me to take my phone, so which is great. So I leave my phone in my car, and if my family has to communicate with me or call me, they have the work phone number and they could just call that number. And I know it's been so great, like not checking my phone during my break times at work. It's just nice, not having that. So what is the impact of digital overload on your brain? Our brains are naturally wired to seek stimulation, and the digital devices we use every day are expertly designed to exploit that tendency. Every ping, every swipe, and notification triggers a release of dopamine, the same chemical involved in habit formation and reward loops. This makes it really hard to put our devices down once we pick them up. But in healthcare, multitasking is the norm, juggling patient care, documentation, and digital alerts. This constant switching fragments at our attention. The result, we become less productive, more stressed, and more prone to making mistakes, all of which can impact patient care and our own well-being. A study on smartphone addiction among nurses found that 55% showed moderate smartphone dependence, which was closely linked to procrastination, mental fatigue, and poor focus. But here's a quick breakdown of what digital overload does to our brain. Constant notifications trigger dopamine release, trapping us in a cycle of reward, seeking, and distraction. Multitasking fragments attention, reducing focus and increasing the likelihood of errors. So I'm just reiterating what I mentioned earlier. Cognitive overload drains mental energy, leading to fatigue, poor decision making, and burnout. Digital dependency disrupts emotional regulation, increasing stress. The one thing you don't want is to be extremely stressed from having a digital overload. Anxiety, and making it harder to manage emotions effectively. Understanding this helps us see why digital detox strategies aren't just nice to have, they're essential for protecting our brains, our work, and our health. So, another pause and reflect question. When was the last time you noticed your attention slipping between multiple digital tasks at work? How did that affect your focus or your mood? How do notifications pull you away from important care or documentation? Can you identify any patterns in when or why this happens? What signs of mental fatigue or decreased focus have you experienced after extended screen time or multitasking? How aware are you of the emotional impact of digital overload, like increased stress or anxiety in your daily routine? What small step could you take today to reduce multitasking or manage digital distractions more effectively? How might creating moments of intentional focus or digital breaks improve your productivity and emotional well-being? So I'll give us another 5 minutes to go through these questions, and Carissa, our moderator, would read them out. Thank you. Read out your responses. There we go.
Yeah, so feel free to find a question that resonates with you and plop it in the chat below. Someone said their attention slipping between tasks is a daily persistent struggle for them. Someone else said forgetting what I opened an app to do. Another person said multiple digital tasks affect their focus. They forget what they were looking or doing, so kind of along the same lines of that, disrupting their ability to focus on a single task. So they end up multitasking between multiple digital tasks. They made the mistake, they make mistakes and documents in the wrong chart, which means more time to correct and review all their work in that time frame. It fills you with self-doubt and frustration and exhaustion. This is another good one. Focusing on something and then feeling like I need to check my email or Teams, but there's not really a concrete reason. They just feel like they need to. So they're in the loop of things. And that increases your irritability and your stress. Someone else said they're distracted with phone calls and text messages at work daily. Maybe thinking about the reflection question on what small steps we can take to reduce that multitasking or manage those digital distractions. Someone else said they're pulled away by notifications a few times a day. They check their phone instead of taking a actual break, and happens when they feel they need a break, and that's what they resort to.
Thank you all for sharing. I'm just going to resume our session again. We have a very interactive group, I must say. So, what are the small powerful shifts that you could do? So, the solution to a digital detox doesn't have to be drastic, but you can think in small, manageable shifts. So you can use a grayscale filter on your phone to reduce screen time. You can take 1 to 2 minute breaks between patients with no screen. Designate a no charting day at home if you work from home and you're working after hours. Keep your phone out of the bedroom. Someone says they do that already. Kudos to you. These small actions signal safety to your nervous system and create space for recovery. A 2023 PubMed study on digital wellness programs for healthcare workers showed that a 24% drop in self-reported burnout after just 6 weeks of intentional digital reduction. So, I mean, the numbers shows that it actually works. But these are just points I mentioned earlier. So I'm actually going to leave each and every one of us today with a 7-day digital detox challenge. So day one, you can decide not to use your phone during breakfast. You don't have to follow this. You can actually like make a plan that works for you. But this is something I developed for us today. Day two, turn your phone to grayscale mode. Number three, take a 10-minute tech-free walk. Day four, avoid screens 30 minutes before bedtime. I usually do an hour before bedtime. And when I go to bed, I don't take my phone into my bedroom as well. I leave it somewhere close by. Day five, designate 1 hour of no screen time at home. Day six, journal for 5 minutes instead of scrolling before bed. Journaling is a game changer. It helps you process emotions, process feelings. It's just amazing. It's kind of like having a conversation with yourself in a different way. Day seven, choose one day this week to skip charting at home if you work from home. So this brings us to our questions and answer session. So Carissa is going to open the floor for questions.
Yeah, so if you have any questions for Sosa, feel free to put them in the Q&A or the chat box, and we'll hopefully get those answered for you. Nicole asks, do you recommend specific apps or platforms that help decrease screen time?
Hmm. Apps or platforms that help decrease screen time that I haven't looked into. But I do know that there are apps that you can use to calm your mind, like Calm, that app. It's a mindfulness app. And it definitely, when you use it, it helps you feel calm. Yeah, but I haven't looked into apps that could help you reduce screen time. But that's a good question, and that's something I can look into.
Someone commented a minimalist phone, so maybe just a phone that's just meant for calling and texting. Another question says, what should we journal about?
Well, this is a great question. You could actually journal about your whole day. You can journal about um your challenges at work, things that went well, things that didn't go very well, things you'd like to improve on. Or sometimes you don't really have to have what to journal about. You just have to get a pen, you have to get a paper and just write. Just write whatever comes to your mind. And then that's very therapeutic. And then you could actually do that, keep it for a couple days and, go over it and see if there's a common thread in what you have been writing, if there's a common theme or if there's a connection between all the things you've been writing over the days. So that's something you could also do. I hope that answered your question. Karamvir. Low minimalist. Okay, nice.
I've also heard that there are apps that can reduce right when you open the app, it will reduce giving you access to it right away, and that kind of slows down those immediate dopamine receptors that go off in your brain because you don't have uh, immediate access to what you're going to, so you'll just end up closing the app.
Mm, nice. Another thing, if people like kind of struggling with questions, or one question I'd like to ask is, what's one digital habit you would like to shift this week? You could probably, put that in the chart as well.
Jen says using her phone first thing in the morning.
Oh, delete Facebook.
Not checking work emails at home. I'd like to stop lounging on the couch and doom scrolling. Trying to complete a task before starting another, and it's hard to do in a multitasking position. Someone said their attention span is a bit bad, so they tend to use their phone while watching Netflix, and they're gonna try and stop doing that.
At least you have that awareness, and that's very important.
Well, people are thinking of the questions. Another person said turning off all notifications for social media apps has helped. I like to stop watching the phone while I'm cooking. Another great one. While people are in the chat, I'm just gonna share some closing slides real quick,
Mhm.
just to mention our upcoming events. We all see my screen here. So we have some other good stuff in the work. Our other June webinar, June 11th, exploring our relationship with work, navigating the impact of helping professions. And then July 15th, we have rethinking specialized OCD treatment at every stage. So we have lots of good things in store. Yeah, and if there are any questions, take a look at the chat here. Otherwise, we can give you 10 minutes of your day back. Your Thursday back. Someone said devices are distracting. Real life is not your device. The device is a tool, and that's it. That is reparenting. It's very, very good point. Jen asks, do you have any suggested resources for those with ADHD?
I know that the BC mental health website actually does have that. So if you go onto their website, you'll be able to find some resources. You're welcome. BC mental health and substance use website.